Yes. So this is the case writing task. Here you see Dr. Grantley Cross, and it is a referral letter. He is an endocrinologist. Okay, so Dr. Grantley Cross. Okay, it is here. Okay, so we'll eliminate this one. Consultant endocrinologist, something is more important, so this will eliminate. So Dr. Grantley Cross, consultant endocrinologist, City Hospital. Third line, suit number 32, fourth line. 55 Main Road, fourth line, 1, 2, 3, 4, 5, 6 Newtown, 6 lines. So we have 6 lines here.
So Newtown should be below the address.
Yes.
Oh, okay.
All the lines. How many lines are there? Here you can see. Dr. Grantley Cross, name, profession, city, hospital, street. Okay, main road.
And then on the 5th, the area of the city.
6 lines. Newtown, 6 lines. So we have 6 lines here.
So Newtown should be the.
Yes, please.
There is a delay in my speech and the connection.
Okay, no problem. So here, you listen afterwards. If any doubts are there, we'll see. So this is it. Yeah. So what you have written is, you have written the date first.
Yeah.
So date first you have written. So let me show you the official letter sample, what he has given. Okay, date will be next.
Okay, so first will be the name of the doctor, his occupation and all that.
Yes.
Okay.
Can you see here
then,
now?
Okay. Yes.
So this I'm talking about the date. Date will be after the address.
Okay. And no need to mention to Dr. Grantley Cross, huh? Just
No
directly
need,
Dr. Grantley Cross.
No need. 24 February 2018.
Okay.
So like this you have to write.
Because in the letter there was date was not mentioned, so I put current date. That's
yes,
okay,
current
right?
date only you have to put.
Okay.
Current date only you have to put. Okay. Now let us see here. I'm correcting your paper. Okay. So next. Yeah. So you have written like this. You need not write a date. Anybody can understand if it is date format, right?
Okay.
So I'm giving you because the orientation, the beginning.
Okay. Yes. Yes. Okay.
Because you're total fresher to this, right?
Yeah. Yeah. Totally. First time.
So no need to write a date.
Okay.
When the others can understand it is a date. For example, a boy is there. When others can understand, no need to have a boy tag there. Correct?
Correct.
Okay, like that. So that is important here. Next one, date when you write, you have to write only the first and 2000. So you have to write in full. So how you can write this one is like this. You are supposed to write like this. 8 July 2021.
Okay, so 2021 whole should be written, and also month should be written, not just.
You say 21. Which 21? 1921 or 2021?
All right. Okay. Yes.
For records purpose, it will be problem in the future.
Okay.
So, 8 July 2021, here you have to write. And next thing is what you have to do is, you have to write it after this one here.
Yeah, down.
Okay. Here you have to write. So avoid writing here.
Sure. Okay.
It is okay. I'm not telling it is wrong. It is okay, but formal letter is different, official letter. Okay.
And it's better
Officially,
to write
you
it
have to follow
after
certain rules.
the doctor's name.
In the formal letter,
Mhm.
you should follow some rules. For example, can I come and do your surgery?
No, of course not.
Okay, they'll put me in the jail, right?
Yes.
But if you come and teach English, you will not be put in the jail, right?
Yes.
Because that is harming the person physically. Maybe death will come, right?
Yes. Yes.
Death may occur. So that's why they'll put me in jail. But for example, you can also teach. There are many doctors who are teaching, okay?
Yes.
But I don't know how far they are successful, right? So there are
Yes.
many doctors, but professional, you know, there are many people from many different places. So you selected me and you are learning from me. So that what is the difference? I'm just telling you here. So these doctors, they have prepared medicine not for English. They are professional doctors, not professional teachers, right?
Yes.
That makes the difference.
That's true.
They are born to be doctors, not born to be teachers, right?
That's true. That's true.
That is the difference. That is the only difference. Okay. And second thing is, see, like how you study 5 years medicine and 2 years masters, like that we also study 3 years English and 2 years masters. So like that. For doctors, only one profession, one qualification, but for teachers, two qualifications. First
That's
one is
true.
they should be academically qualified. That means English subject should be masters, number one. Then professionally also they should be qualified. That is teacher. They should have English masters and B.Ed masters, education masters also. So that is the problem, right? They should be teachers also, moreover, right? Now coming to the point here, no need to write to, no need to write date, okay?
Okay.
No need to write to.
It's already understood.
Yes, already understood. We know that this is address, so why to write there? Okay,
Okay.
fine. So this date, that should be in this form. Date should be in digit form. Month should be in number form. Year should be in full. And follow this same format, date, month and year. That is better because officially the address is given like that only, okay?
Okay.
So you take many examples, it will be like this. So why don't you follow the same style? That is what I mean, okay?
True.
Right. Now you said there is no date here. Okay. Now here treatment record. Okay. Now see here 26/11/2007 is the this one.
Yeah.
So now you have no other. Yeah, 2008. Okay, fine. Right. So actually you are writing this letter on this last time, or maybe a little later. Okay, no problem. For you, no
So for
confusion
sure, the
because you
date
write the
for
test
the
date.
sure the date should be after the last visit. But
Yeah.
since I wasn't sure,
Yes,
so
yes, I understand. I understand. So maybe sometimes they will not give, maybe he's at home and afterwards you are writing the letter. So no problem. For you, no confusion because the test date will be the letter date. Okay.
there will be letter, huh?
Yeah, same date you have to write. No worry regarding that.
Okay,
Right.
all right.
Whatever day you are writing, the same letter, same date you have to write. Next one.
Okay.
So here, Dr. Grantley Cross, you have written. But why should I read it very clearly? I'm not your friend. I'm not your relative. I'm not your junior, right?
Yeah.
This is looking like D for me.
Yeah.
The D is looking like D for me.
The writing should be improved.
Then your N is looking like U for me.
Yeah.
Okay? Your R is looking like V for me. And your S is incomplete.
Yeah.
Okay. So I don't know. Next letter, it should be totally transformed. Okay.
Sure. I will try to, be
Next
more
one.
legible.
Next one. It is for your own benefit.
I
Next
understand.
one is when you are writing, you see.
Okay.
You
Yes.
see,
Yeah. It's moving from side to side.
Yes. That means it's something like not very, okay.
Yeah,
You
it
need
doesn't
to
look
put
professional.
care
Yes.
in this one. How much care you put in a patient, yes or no?
Of course.
So why don't you think that this is a patient and you are filling it up with medicines? So this
Yeah.
presentation,
I should be more
you
careful
have
with
to
that.
improve. Okay.
So two things for sure, writing and
Yes,
this
I don't want many things.
movement.
I want your left margin. Number one,
Yeah.
maintain your left margin
Okay.
without fail.
Sure.
Okay. Maintain your left margin without
We'll
fail.
keep that in mind,
Because
definitely.
this letter will be considered as illegible and you lose your mark. Okay.
Of course. Of course.
So I have to discuss all these things like that one. Next one.
Sure.
Endocrinologist. Endocrinologist. Where is the S?
Yeah. Missing.
So when you are not bothered about neatness, you will do mistakes automatically. When you are careful, things will happen better, right?
Yeah.
When you are not very cautious, automatically mistakes happen out of your knowledge. You don't know that you are doing a mistake also, right?
Yeah.
See here, this is you have written hospital, but this looks like D for me.
True.
So, right.
Is
Next
there any? Sorry, I'm cutting you in between. Should I write in block letters or anything like that?
No need. Small letters enough or cursive writing. Block letters, no need. That is again another type of mistake. Okay, next one. Before comma, no space. Can you see here? You put space here.
Yeah.
And here also space. Immediately you have to put, okay?
Yeah.
No space. And this is Newton or Newtown?
Newtown.
Then you wrote Newton, right?
Yeah.
Newton, because you remember the name of the person, you wrote the name of the person.
Yeah.
Okay, it's not a person, it's a town. Okay, so you have to be very clear when you are writing. Okay. Next, dear Dr. Cross. I hope this letter finds you well.
Is it okay if I mention this the last name, or should I mention the whole name?
That is
of
last
dear
name
doctor?
only you have to write. Correctly you have written. That's why I did not say anything.
All right.
Okay. I hope this letter finds you well. This is not a friendly letter and you're not supposed to write like this.
Okay.
This is purely formal letter, and as a doctor, you should know that your time is very precious. So is the time of others also.
All right.
There is no personal feelings and personal touch here. Only professional touch.
Sure.
You need not hope anything. Direct into the subject matter.
Sorry,
No beating around the bush.
All right.
Okay. Now, I am writing this letter to you. Okay. Can anyone speak a letter?
No.
No. That means anyone can write a letter only, no?
Yeah.
So we know that this is a letter. Anybody can tell, right?
Yes.
By seeing this one, anybody can say this is a letter, right?
Yes.
Can a doctor not understand that this is a letter?
No, of course not.
So that means you are giving that information which is not required and which is already understood. That means by default, it is irrelevant information you have given. You are just beating around the bush in the first 2 lines. Is that clear?
That's true. That's clear.
Do you want me to be soft or do you want me to be harsh? Harsh means not angry, but to be serious.
Harsh. Be harsh. I want you to be harsh.
Because
I want
if
you
you want to get excellent result, you should get harsh.
I want you to be harsh.
Afterwards, you should not say, sir, Simon, sir, I am a doctor. Don't I know all these things?
No. I am here. You're my teacher. It doesn't matter if I'm a doctor or a professor myself. Right now, you're my teacher. So yes, you should be harsh and you should be clear about it.
For this.
I actually prefer you to be harsh rather than, be soft on me. And,
you are the loser.
Yes. So I prefer you to be
harsh. I am writing. You know that you are only writing and everyone knows that you are writing because at the end of the letter, your name will be there or your signature will be there, right?
That's true.
So there is no need of what is in the external area should not come in the internal area. Internal area will be only the stomach, not the head and the tail. Okay.
All right.
Head
Sorry, I
is
didn't
the
get
receiver,
that point.
tail is the
What do you mean?
sender. Head is the receiver, tail is the sender.
Sorry, I didn't get that point.
Head is the receiver. Who is receiving the letter is the head.
Okay.
That is the to address.
Mm-hmm.
From address is the tail, right?
Ah, yes, yes.
That is the sender. Now you are clear.
Yes, yes.
So sender should not come in between. Receiver should not come in between. Okay.
True. So the receiver
no
should be on top,
and,
and I should mention my name just in the end.
No eyes,
Nothing
no
else.
use.
Okay.
You are writing the letter means everything is your report. So I did like this, I did like this, I operated, I treated, I recommended.
No need.
No I at all, as far as possible.
Mm-hmm.
The more the eyes, the weaker the letter.
Okay.
Okay. In the same way, the more the use, the weaker the letter. Okay.
True. Okay.
And the more the he, the weaker the letter. So the receiving doctor is not important. The sending doctor is not important.
The material is important.
Is not important. They are externally important. What is going on is important, right?
Yeah.
In your hospital, you are not important. The patient is not important. The hospital is not important. The nurse is not important. The surgeon is not important. But the operation is important, right?
Right.
Is that clear?
That's clear. Yes.
So the central one should be only operation. It is called emancipation. Emancipation means separate yourself from the scene.
Okay.
Only what is going on is important. We already know who the patient is because in the subject only you told. Correct?
No, I haven't.
Everything is related to the patient, right?
Yeah, but I haven't mentioned the patient as yet.
Okay, no problem. So what I'm telling, normally we no need to mention every time. Okay.
Okay. All right.
Number 2, because many people will think a new paragraph. No need. It is subject itself. It's not a new letter, right?
Mm-hmm.
In the beginning of the letter only we said, right?
Yeah.
So new paragraph. So what? A complete letter is free. Complete house is yours. Every room in front of every room. Mr. Abbas bedroom, Mr. Abbas living room, Mr. Abbas kitchen. No need to write, right?
Yeah.
You understand now what I'm saying? With solid example, I'm telling you. Many people do. It doesn't mean that it is right.
Mm-hmm.
Okay? It's okay. Right. Next one. To you. No need to you. Okay?
Okay.
Now here, you can directly write Mr. Breast Collister. Okay?
Okay. So the first 3 lines, I should just remove.
I am referring if it is a referral letter.
Okay. It is
Otherwise,
a referral letter.
thank you for seeing. Okay?
Okay. Okay. So instead of the first 2 lines, I should just directly mention that.
Directly you can write. See, it is a waste of 30 seconds for you only. Correct?
Mm-hmm. Yeah.
I am a doctor and I am writing to you. You are cross and I am writing. You will really be cross with this letter.
So instead of all this, I should directly say this.
Directly you can
referral letter is regarding Mr. Brent Collister, like that.
Yes.
Okay.
So, thank you for seeing Mr. Brent Collister. Can you see here?
Yeah.
Finished. Okay.
Okay.
Is that clear?
Yeah. Yeah.
Straight. Straight. No beating around the bush.
True. Okay.
Right.
Okay. So I missed the introduction of Mr. This also, the patient's name.
Okay. Here you did not put the name of the patient.
Yeah.
Okay?
So I should mention the name of the patient.
Subject. Okay. Regarding. Dear Dr. Cross. Okay.
Okay.
Then
can you go back to the written page? I want to see that.
Yeah, I'll show you. I'm writing here. Regarding. Okay. So Brett Collister. Mr. Brett Collister, comma, and how old is he? That we have to see.
Mm-hmm.
How old is he? Let us see here. He is, okay. Now
1973.
Date of birth 21st December 1973.
Yeah.
Okay. And age is not there here. Age is not given.
Not here. So I will mention the date of birth.
Yeah, age is not given. So what you can write there?
Date of birth.
Okay. Now here, one second. Date of birth, comma, DOB, capital letter, colon. And what is the date there? You have to see. Okay.
Right.
Date is this.
21 December
1973.
Yeah.
Okay. Right. Okay. 21 December 1973. Like this you have to write. Okay.
Okay.
Like this you have to write. So regarding Brett Collister, so after the salutation, you have to write that.
So in the case of sample letter, they have after the name, they have actually put the date of birth below it, not after the comma.
Yes.
So how should I do it? The way you told me or the sample?
Yeah, both are okay. So here it is better, dear Dr. Cross, then afterwards. Okay, like this, I will write here. Okay, dear Dr. Cross, comma, like this. You can use like this, okay?
Okay.
You can use like this. So fine. Next one. So fine. Thank you for seeing Mr. Brett Collister, like that, right? Who has, what is this? Diabetes mellitus. Okay, who was diagnosed with diabetes mellitus, right? Or who has had diabetes mellitus for the last 15 years, whatever, however you want to write, you can write. Okay. So next one, then next one you can say, for your expert assessment and management or whatever you want to write, you can write. Is that clear? Okay. So based on suspected of diabetes mellitus. Okay. So here you can say, Mr. Brett Collister, whose signs and symptoms are suggestive of type 2 diabetes mellitus, requires your, okay,
expert opinion and management.
Now you got it, right? Because that is your game. You can play that one. Only the thing is, I am putting the frame. I'm just putting the skeleton. Afterwards, you can put on the skin. Okay.
Okay.
Okay, fine. Mr. Collister was born on 21/12/1973. I don't think this is important, right?
Yeah, because we have already mentioned it above.
Already you have mentioned in the beginning itself.
Yeah.
What date of birth, right? So this sentence is irrelevant here because when you used only 21 December 1973, then here it is not necessary.
No need. No need. Yes.
Okay. Then he is a
foreman, the profession I've mentioned.
Foreman, spelling mistake. Because it is not clear. Okay. What is this?
At a factory.
At a factory. This is a spelling mistake. Now whatever I'm not able to read, I am underlining that is considered as spelling mistake. This is one spelling mistake. This is one spelling mistake. This is one spelling mistake. Okay. Whatever I'm not able to understand, I don't want to take the pain of understanding. So like this, if so many mistakes are there, year. Why do you want to write year? In 2006 means year only, no?
Yeah.
Nobody will say any month, no? Or date, no? In 2006 means automatically it is understood that it is year. Why do you want to waste one word year? Correct?
Yes.
Mr. Collister has suffered from, not now. Now not suffering, only suffered in the past, present, recent, present. Okay. This is not clear. This is not clear. Okay. He was not clear. Ibu pro.
So instead of has suffered, I should write has been suffering, like that.
Yes, who has been suffering, but avoid the word suffering as far as possible.
Okay, so instead I should
You can say who has had, like that one, or who has a history of something. Check you when you are writing, I'll improve those things. Okay. So these are all considered as mistakes.
Okay.
Automatically. Suffer. You are repeating the word suffer. You cannot write like that. Okay. You have knowledge. Only the thing is, don't know the technique. That's all. Okay. Moxie. Okay. Yes. Now you already written the letter. Now I want you to practice your hand. Okay.
Yeah, the writing.
Right. You have to write it in a beautiful. You should decorate him. You remember on your marriage day how you were? Flawless, right?
Yeah.
Yes or no?
Yeah, of course.
Flawless. There is nobody can point a finger at you, right?
Yeah.
Huh? You are the king of that day. So like that one. Your paper, see, this paper is not like a prince. It is like a pauper, right?
Yeah. Yeah.
So now you know everything you know. Okay. You know, you are focusing only on writing, but don't focus on writing. More than writing, presentation is important, right?
Okay.
So let me tell you one example. On your marriage day, I am your best buddy, childhood friends. But still, your marriage is going on in Oberoi Hotel or some other hotels, very famous hotel. Okay. Can I come? Can they, will they allow me if I wear dirty dress and go?
Yes, they will allow you, but I get your point.
They will never allow me, right?
I get your point. Yes.
Hotel, it has dress code, right?
Yeah.
So they will not allow. So in the same way, you know, that impression will get negative impression. You have written everything well, no problem, no doubt regarding this. If you read, almost everything will be 50-70% correct. It will be okay.
Yeah.
The problem is what you have written, you are not able to communicate me. So that means it missed the mark. Main purpose is communication, and you lost there only. Now you understand?
Yeah.
Is that clear?
Yeah, that's clear.
Okay, fine. So what I'm going to do is, I'm going to give you a second session in this one. I want your handwriting to be so beautiful and so awesome. Everything is right. I know. I hope the above information will assist you to initiate
further
assessment
and start management
for diabetes mellitus type 2. Very good. Should you need further information, please do not hesitate to contact me. I can understand. It's not that I can understand, but why should I take pain? Correct or not?
Yeah.
So that is the point there. So now total transformation should be there. Okay.
Okay.
Right? Total transformation should be there. Okay. Now this letter I am doing for you. Okay. This letter I am doing for you. But you have to still write and send it to me. Okay.
Again, same letter, right?
The same letter you have to write and send me. I want for your handwriting. I am correcting this letter.
Okay.
Now I am correcting this letter. I am taking the pains for you now. Okay. Because first time, no?
Yeah.
So I am taking it. No worries. But what I am asking you is, yes, 1 second. Here it is. Okay. PC, D drive. Corrections. Okay. Yeah. So I'm taking the pain for you and I'm doing everything for you today. But tomorrow onwards, You have to do on your own. So 1011. Yeah. This is your letter. File save as. Save as. Feedback. Ground 0. Okay. Now we will go to elevation now. Level 1. From the basement, we are going to the level 1.
Yeah.
Yes. Here it is. Yeah, this is your letter. Date 8/7/21 to Dr. Grantley Cross, endocrinologist, consultant, City Hospital, Suite 3255 Main Road, Newton. Dear Dr. Cross, I hope this letter finds you well. I am writing this letter to you for an expert assessment and management of Mr. Brett Collister. Based on his previous history, he is suspected of DBM type 2. Mr. Collister was born on 21/12/1973. He is a foreman at a factory and is married. He has no known allergies and has a past history of infectious
mononucleosis
in year 2006. Mr. Collister has suffered from
musculoskeletal. Skeletal. SKELE.
Okay, musculoskeletal twin in 2017. He was prescribed ibuprofen and advised liposign.
Ibuprofen.
Ibuprofen. Oh, that's finished. Next.
And advised, you're reading which line? Fourth line?
Yes, fourth line.
To be honest, I can't read it.
Okay.
Okay.
So that means
Collister
you
suffered from
cannot read
muscular
then how
pain
much
twice
difficult.
in 2017. He
Okay.
was advised. No, I don't know. Lifestyle.
Weight reduction.
Sorry, it's a lifestyle
changes.
change.
Okay.
Yes.
Advised lifestyle changes, weight reduction, and
Exercise.
But he was non-compliant with it.
Just before 2017, the first time, it's twice, not twin.
Okay, no problem. We'll do that.
Hmm.
Mr. Collister also suffers thrice from upper respiratory.
It's again twice, not thrice. It's Mr. Collister also suffered twice from upper respiratory tract infection. Again, I wrote twice in 2017. This is again, I have to delete one of the twice. Yes. Okay,
Respiratory tract infection twice in 2017, treated with amoxicillin. Mr. Collister presented to the clinic with vague symptoms of in 2018. Upon investigation, his blood sugars level, both fasting and random, were higher than normal, along with high HbA1c. Also, his lipid is also
deranged.
Okay. I hope the above information will assist you to initiate future assessment and start management for DM type 2. Should you need future further information, please do not hesitate to contact me. Regards, Dr. Abbas Zainli.
Bellhole Specialty Hospital, Dubai. I didn't know what to write. I mean, at that point.
Okay, Bellward Specialty Hospital, Dubai.
Yeah.
Okay.
That's my current, work. place.
Okay, no worry. So what I'm telling you is, okay, fine. Now you have noticed what the problem is, okay?
The biggest problem is my handwriting.
But we'll see. First of all, we'll see what you have written and how to improve. I don't know what you have written. I just read it out, what the computer typed, almost the same. How you are writing like that, the computer spelling. Okay, no problem. So now let us make some sentences. I'll just give you some basic sentence structures, which will be useful for you in every manner. Okay. Now here, I hope the above information will assist you. Why should you hope? You don't know? Correct or not? Why should you hope?
Yes.
You know, no? You don't have guarantee that the information is useful for him?
It is useful, but how should I?
You cannot say, I hope.
Okay.
Correct? No. It is useful, that's all. So no need to hope.
So this is something extra, no need to add this.
Yes, no need. Okay. So that is just a formal word, formality like that one. But this is, special word, special style, official style. Okay. Right. I hope the above information will assist you to initiate further. So here directly, now this same thing I am taking. Okay. Insert. Yeah. I have put it in a table now. I have put that one in a table. And then I am correcting that one now.
Okay.
So the same things I'll take. But I'm modifying one sentence here. I hope the above information will assist you. This is not needed. Okay.
Okay. We'll delete it.
This is not needed. Right. This is not needed. So I hope I is not needed. First of all, I should not come. Right. I should not come. Danger zone. Then the above assist you. You is another danger zone.
Okay.
Hope means you are not sure. If you are not sure, then why are you writing?
Okay.
Correct, no? So find out and write, no?
Yeah, okay.
So if you say like this one, that means you are not eligible to assess what is needed and what is not needed. Okay.
Okay.
That means you are only cutting your own leg. You understand?
Yeah.
So I hope the above information will assist you to initiate. So till here it is not needed. So the above information will assist. This is not necessary.
Okay.
Okay, then to initiate. Okay. Further assessment. Okay. This also, what to initiate will remove. This is green. Okay, green means okay. Green means okay. Okay. Sorry. Yeah, green means okay. Initiating, you can say, okay. Initiating further assessment. It's initiating specialist assessment or appropriate assessment. Okay. Not preliminary assessment, appropriate assessment. Okay.
Okay.
So initiating appropriate assessment. So here above information is there, no? So here you can write based on, you can write just okay.
Okay.
So based on the above information, this you can use. Okay.
Okay.
So now it is working fine, right?
Yeah.
So you can start like this. Based on the above information. Okay, we'll keep it like that. Right. Okay. Here. Based on the above, based on the above mentioned. Okay. Information, comma, based on the above mentioned information. Is that clear now?
Yes.
Next one, initiate, to initiate. So this is green. Okay, I hope the above. So here it was not there. Okay, I hope the above information will assist. That is what you have written. Correct?
Yeah.
The above information I have taken here, right?
Yeah.
And I changed it into above mentioned. Okay. And then you will put a comma there.
After the information.
Based on the above mentioned information, comma, right? Prabjit.
Yes, sir.
Write a message in the group saying that this is an important lesson. Sir is teaching some structures.
Okay, sir.
Basics. Please go and write there. Sir asked me to write here. Please join because it is very important. Okay.
Okay, sir.
Okay. I'm not teaching doctor's letter or nurse's letter. Based on the above mentioned information, comma, initiating appropriate. No need initiating. Only initiating is important or assessment is important. Starting is important or complete assessment is important. You tell me.
Complete assessment.
So no need initiating also, right? Correct or not?
Correct.
So to initiate means starting. That means incomplete. Why do we want incomplete things? Correct? No. I want to play football. Am I playing? No. I want. That's all. Okay.
That's right.
So just write appropriate assessment. Enough. Okay. Appropriate assessment and further management. Is that clear now?
Yes.
Appropriate assessment and further management. Okay. Further management of Mr. Collister, apostrophe S, condition. Okay. Would be extremely beneficial. Is that clear now?
Yeah.
Your sentence only little modified, that's all.
Yeah.
So I brought a standard style, right?
Yeah.
So here you wrote appropriate assessment. Same thing is there, appropriate assessment. I did not change anything there, right?
Yeah.
Okay. Now appropriate assessment you only have written. I did not do anything there. This is your sentence, green. Okay. Right. Appropriate assessment is there. And also is there. Then management also is there. Okay. Finished. Okay, these are your words which I took from there. Then I used based on the above mentioned, I added information, appropriate assessment. Okay. So to initiate removed because it is not that quality.
Okay.
So removed. Appropriate assessment and further management. Okay. Of Mr. Collister's condition would be extremely beneficial. Is that clear?
Yeah.
Simple. Because already you have written diabetes mellitus in the beginning. Why do you want to repeat?
Okay. No need.
No
need to repeat,
Okay. And if you have already written assessment in the beginning, here you write evaluation. Here you already assessment you have written, right? Then why are you repeating the word?
So instead of assessment, I should.
You can say evaluation.
Okay.
You can change this word, no?
Mm-hmm.
Correct or not?
Correct.
So this is danger now, red zone. So now what I am doing here is, I am removing this. Okay. Right. Okay. Appropriate evaluation or expert evaluation, you can say, okay?
Mm-hmm.
And further treatment, you can say. Can you say treatment?
Yeah, you can.
Okay. So you can say, because management here again you used, no?
Yeah.
You used here management assessment. Same thing you are writing.
Mm-hmm.
Expert you used here already. So I've changed.
Mm-hmm.
Okay. So here, this is how you have to consider. Okay. Never use a word as far as possible. Okay.
Okay.
So this is assessment. You have already written. So appropriate evaluation and further treatment. Okay. Okay. Of Mr. Brett Collister, health condition would be extremely beneficial. Okay.
Okay.
Then if
why do we have to write health condition? Why not just condition? Because we mentioned we are already.
If you think words are less, you can write. Otherwise, no. Okay. So if any additional information, because all the information I have given you, relevant information. Still, if you need anything extraordinary information, then you ask me, I'll find out and I'll give you. That is the meaning. If any additional information is required, passive voice, do not hesitate to contact me. Okay.
Okay.
So you got 2 solid sentences, right?
Mm-hmm.
So here you got 2 solid sentences here. So this is how you can improve. Fine. And here starting. So there you have written date. Then you wrote 2. Okay.
So no need to mention date and 2.
No need to mention all these things. Okay. Okay. So just directly you can go ahead. Right? All capital letters should be there in the address.
Capital letters.
All capital letters.
Okay. Also the name or no?
Yeah, everything.
So the first 5 lines will be
every word, first 5 lines will be capitals.
Okay.
Okay. Okay. Main road. Main also will be capital letter. Road also will be capital letter. Okay.
Okay.
So 2 is not needed, right?
Yeah.
Okay.
And date should be down now.
Okay. Now let us see here. This should be written like this is wrong. Okay. This is wrong. Okay. City hospitals. Okay.
All the letters should be capital or just what?
All the letters. No, not all. First letters.
Okay, first letters. Yeah.
First letters of all the words. Main road, Newtown. So that is it. So endocrinologist, consultant, no. You have put it in bracket. This consultant should come forward. Okay. And that also should be capital letter.
Capital.
Right. So this is how you have to write. Dear Dr. Cross, you did not write the subject. Okay. I hope these letters, hope, you are maximum you are using hope. See, first line you have used hope and last line also you have used hope. Okay.
Okay.
Hope means not standard. Okay.
Yeah. One more thing. I did not mention, the name and details. That is after the address.
Yeah, that is after address. That is here after salutation here. Okay. Dear Dr. Cross, after that.
Okay, all right.
Dear Dr. Cross.
Regarding
this one. Regarding, okay?
That clear? And after Dr. Cross, I have to mention whole doctor, not like DR, not the short form.
Oh, sorry. Yeah, dear Dr. Cross, we have mentioned, no?
No, my question is, instead of DR, you have written whole. Like...
no, that is title, you can write like that, no problem. Okay?
So DR Cross is also okay, right?
This is enough, this is enough.
Okay, and there is no comma after cross.
You can put or you need not put, no problem.
Okay.
Okay, I'll show you the example. Okay. It's not compulsory. See here, comma is there here, right?
Yeah, okay.
Okay, sometimes it will be there, sometimes not there. Okay.
No problem.
No problem. That doesn't. Now see here. Is there a comma here?
No.
No. So if you put, you don't put, no problem. Is that clear?
In this example, the regarding part is above.
In this part, regarding part is up. But normally, subject will come after. Subject will come after salutation. Okay. Subject will come after salutation. Okay, because it is a part of the little bit above the body. Okay. So first, who should read will be there. Afterward, about what it is, he should know. Okay.
Okay. All right.
See, not everyone needed to read about what. No. Only the person who is the reader, he needs to read that one, right?
Yeah.
Which is important. See the subject, then afterwards see who has to read it. No.
Yeah.
Subject should be only to the relevant person, right?
Yes.
Not after, not anybody. Anybody will come and stop at dear Miss Bruin, right?
Yeah, if he or she is not Miss Bruin,
Mr.
then
Bruin,
they will stop.
Then they'll stop there.
Yeah.
That means subject is not related to them, right?
Yes.
Now you understand the reason why I am telling you?
Yes.
So, subject is required only to the person who is receiving the letter, not everyone. Why should others read? For example, the letter is open on the table. They'll say, oh, this is Dr. Miss Bruin, not for us. Leave it. Finished, right?
Yes.
So, that means that subject is only for the person concerned. Okay. So, it should not be before the subject. It should be after before the salutation. It should be after the salutation. So that only the person who is relevant, that person only will read. Okay. This is by mistake. Okay.
Yeah. Okay.
This is right. Can you see? This is right. Okay. Now see here. Here he has written 2 sentences. Thank you for seeing Mr. Brett Collister, a patient at this practice, who presented today with complaining of sore eyes and worsening vision. Okay. I am concerned that he has been experiencing symptoms consistent with type 2 diabetes. You can write in 100 different ways. Thank you for seeing Mr. Brett Collister. Okay. Who has been experiencing symptoms consistent with type 2 diabetes. Okay. Or you can say, thank you for seeing Mr. Brett Collister, whose signs and symptoms suggest. Okay. Type 2 diabetes. Okay. You can write 100 different ways.
Yeah. Okay.
Is that clear?
Yeah. Hello.
Sorry. So, Mr. Abbas. Hello, Mr. Abbas. Hello.
Yes. Yes, Mr. Simon.
You did not use the word refer, right?
No.
It is a referral letter and it did not use the word refer. That is the biggest mistake you have done. Okay, fine. Now let us come to the point here. Here you can write in two different forms. You can say, you can start the sentence with the thank you for seeing. Okay, thank you for seeing ... Or you can also say, I am referring. Don't say I am writing. I am referring. Okay. So
Mr.
these
Brent
two words
Ross.
you can use. Okay. Or you can directly start with Mr. Brett Collister. Three different types I am showing you.
Which one is better, by the way?
Collister. So three different styles. Okay.
Of these three styles, which one is the preferred one?
Thank you for seeing Mr. Collister. All are okay. All are okay. Nothing is problem. Thank you for seeing Mr. Brett Collister. Start like that. I am referring Mr. Brett Collister. Start like that. Or Mr. Brett Collister. Start like that. Okay. Then immediately after this, you can start with who.
Start with what?
Comma who. Is that clear? Who? WHO. Who?
Okay.
Mr. Brett Collister, comma who. Okay.
Yeah, the image is little blurred.
These two things should be separated by a comma.
Can you do something about the image? It's blurred now.
The image is blurred now. Okay.
And your voice is also, not clear.
Is the size then? Now is it okay?
I can't hear you properly.
Is it okay now? Yes, I think it will be fine now, right?
Yeah, it's better.
Okay. Thank
But
you
your
for
voice
seeing
is
Mr.
is breaking. Mr. Simon, your voice is breaking.
1 second. I have no problem. I'll reconnect. Electricity has come back. So electricity is back. Yeah. Okay. Thank you for seeing Mr. Brett Collister who dash. I am referring Mr. Brett Collister who dash. Mr. Brett Collister who dash, like that. So, or whose signs and symptoms are suggesting signs and symptoms are, who exhibited the signs and symptoms. Okay, like that one. However you want to write, you can write. Okay, now let us take one point here from this. Okay. Yes. Now, who has been experiencing signs and symptoms like this?
Again, the image is blurred.
Image is blurred. One second. Okay, text. Okay. Is that clear now?
Now it's clear.
Okay. Who has been experiencing signs and symptoms consistent with type 2 diabetes, comma. Okay. Here also the same thing. Comma. And here. Same thing. Everything has the same style. Okay. Now these are the three forms I have given. Thank you for seeing Mr. Brett Collister who has been experiencing symptoms consistent with type 2 diabetes.
So can I write like this? Thank you for seeing Mr. Mr. Brett Collister. Just directly, instead of who, I should mention he has been experiencing symptoms consistent
so you
of.
are breaking it into small sentences then, right?
Yeah.
So if you write in small sentences, that means quality is again in diminishing, right?
Okay. So
you're
better.
writing like a schoolboy then. It shows that you don't know how to join sentences then. Right?
Okay.
Okay. Who has been experiencing symptoms or who symptoms, signs and symptoms are consistent with type 2 diabetes. Like that also you can write. There are many ways writing. Okay. Then next one. full stop. If you write like this, you will write a full stop here. Okay?
Okay.
I am referring him for your expert assessment and appropriate management. Okay. Right. I am referring him for expert assessment and appropriate management. So you can take that one. Okay. I am referring here. Then you can take like this. This piece you can take from here. Because already you have written I am referring. So no need to use that one here, right?
Okay.
See here you continue with for expert assessment and appropriate management. Finished. Okay.
All right.
Then
But in this
one.
case, there is comma after type 2B, type 2
Yes.
diabetes.
Yes.
Yeah. Okay.
Because second one is one sentence, no?
Okay.
Okay. Here two sentences. Before full stop and after full stop.
Yeah.
Right? But here only one sentence. Mr. Brett Collister, who has been experiencing symptoms consistent with type 2 diabetes. Okay. Mr. Brett Collister, who has been experiencing symptoms consistent with type 2 diabetes, requires your, okay. Now let us see the letter once again. Sorry. What is happening here? Here it is. Not here. Yeah. Treatment. Yeah. So, Mr. Brett Collister, who has been experiencing symptoms consistent with type 2 diabetes, okay, requires special, okay, is being, okay, requires a special assessment, okay, and appropriate management. Finished. Okay.
Requires special assessment or specialist assessment?
Specialized assessment, specialist, special assessment. Okay. Special assessment means by a specialist. Then you have to say specialist's assessment. Like this. Special assessment. Or you can just, if you have any confusion, you can write normal thing. Expert assessment. Okay. Expert is an adjective, special is an adjective. Specialist is a noun. Okay. So you have to use adjective here before assessment.
Okay.
Not noun again. Okay. And appropriate management. So these are the three different styles. Then this reference, you can put it in the last if you want. Okay. Last sentence, last paragraph you can write. I am referring. Okay.
Okay.
This you can put in the last sentence. Last paragraph, fifth paragraph you can put. That also is not a problem. Okay.
Okay.
Right. Or else you can say like this one. Mr. Brett Collister has been experiencing symptoms consistent with type 2 diabetes. Okay. Now requires remove. Here you bring this one. I am referring him for expert assessment and appropriate management. Finish now?
Yeah.
They're clear now?
Yes.
So I have taught you how to write introduction. I have taught you how to write conclusion, right?
Yeah.
Is that clear?
Yes.
So now from now onwards, write very neatly because you are going to lose. Okay. It's 30,000 rupees OET, right?
Yeah.
So follow it up and make the best out of it, right?
Yes.
Okay. Then again, I will, now you have understood what is feedback. Okay. Now tell me, what did you learn from this session?
The most important thing I learned is to keep my writing legible and to keep the, the margins straight instead of, moving from side to side. And the other thing is I should not repeat the same word again and again in different paragraphs. Apart from that, the date and to should not be mentioned. It's already understood. And the date should come after the name and address.
Okay.
And after that, we will write salutation, and then we will write the subject regarding whoever is the patient and along with his date of birth or his age, whatever is written.
Yeah. Fine. Very good. So what you can do is now rewrite the letter neatly. Okay. And send it to me. I'm giving you 45 minutes. Okay.
Okay, I will do that.
Or 1 hour. No problem. Take your time. Okay. Take your time. Neat. It should be like, very pretty handwriting. Okay. Okay, fine.
All right. Thank you. Bye.
Okay, then. Next, who is there for correction? There is. Okay, fine. I'll send you the link, all of you. So, Prabjit Kaur. Yeah. Dr. Abbas. Hello, Dr. Abbas. Hello, Dr. Abbas. Hello. Can you unmute, please? Okay. I'm permitting everyone to unmute. Okay. Yeah, Prabjit.
Hello, sir. Good evening.
Yeah, did you learn anything new?
Yes, sir.
Huh?
Yes, sir.
I've shown 3 different types, right?
Yes, sir. Yes, sir.
3 different types how to use. I have shown you now. And in the conclusion also how to make the conclusion. Okay?
Yes, sir.
Okay. See, this is why, presentation is very important, right?
Yes, sir.
A lot of good thing is there in the letter. But the problem is, I cannot read. Means how can I give marks? That is the problem, right?
Definitely, sir.
Okay, fine. Whenever I give this link in the group, no, automatically come and join. You will definitely learn one thing or the other thing. Okay?
Okay, sir. I'll try.
See, doctor accepted. See how many things he has learned. Correct?
Yes, sir.
Yeah. Okay, fine. Hello, Anila. Hello, Anila.
Yes, sir.
Yeah. Did you learn anything, Anila?
Yes, sir. About the introduction and conclusion, I have learned how to write for every letter.
The standard format you can prepare on your own now, right?
Yes, sir.
So little changes you make for that one and it will be perfect, right?
Yes, sir.
So, right. Every time I give a link, you just come and you learn something, okay?
Okay, sir. Sure.
Okay, fine.
Okay, sir.
Then next one. Chitra.
Good evening, sir.
Good evening, dear. How are you?
Fine, sir.
Did you learn anything new from this letter?
Very sorry, sir. Just now only I entered, sir.
Oh, very sad, very sad. Okay. Next one, Sangeeta.
Okay, thank you, sir.
Hello,
Good afternoon,
Sangeeta.
sir. Good afternoon, sir.
Yeah, good afternoon. How are you?
Good, sir. How are you, sir?
Okay, what did you learn this session?
Should not have the redundant word. Should use the different. And also the important of starting from the margins. What you explain to the doctor's letter. That is the one I joined, sir. Previously, I was not able to join.
Okay, fine. Very good. Very good. Excellent. Excellent. Okay, Smita.
Yes, sir.
Yes, Smita, tell me. What did you learn today?
So I learned quality sentences, sir.
Okay. So
Yes, sir.
did you learn that anybody can make mistakes?
Yes, sir. And
There is no differentiation. Doctor or nurse or physiotherapist or podiatrist, no difference. Anybody can do mistakes. Okay.
yes, sir.
Right. So this doctor is for the first time he's writing the letter. Okay.
Okay, sir.
His bad luck. I met him or he met me. Correct? No?
No, sir. No, sir. Definitely will improve a lot after joining your session. I can tell that.
Why we can improve? Tell some 3 reasons why.
Sir, you teach means how you teach. Nobody, no teachers teach like this way, sir.
No, I'm not telling you what you are learning. You tell. Don't bring me in the picture.
So like you said, even you said the handwriting alphabet also. You said that it's wrong. You should write in this way. Like so many things, sir, and minute things which we are not noticed. That all you taught us to do it in a correct way.
Very good. Very good. Thank you. Swarna. Hello, Swarna. Okay. Last, Abbas.
Simon,
Dr. Abbas. Dr. Abbas.
Simon, sorry.
Yeah, Dr. Abbas, I want you to have a few words, address a few words, how the session is beneficial so that the nurses will get some insights from your words.
Sorry, I don't understand. What do you want me to say?
I gave you feedback for today's letter.
Yes, of course.
So what did you gain? Ultimately, what type of feedback you got? Was it good or did it break you or did it build you? Or what?
Very good feedback. I felt that it's a very constructive feedback, and I'm sure with this feedback and a little bit of effort, I'm gonna pass the OET exam.
Okay, not pass the OET, excel in OET, tell. Don't say
Yeah,
pass.
Excel. Yeah, sorry, Excel. Ace it. I will ace it.
Okay,
Yeah.
Right. Okay, fine. Okay, so we are going to meet in the next session. I'm going to give you the link for the next session. I'm going to correct your letters one by one. I'm sending the link. Be ready. How many of you are there here? For those people, I'll correct first. Okay, let me make a note down. So Prabjit is there. Then Linta is there. Sangeeta is there. Smita, Swarna, Chitra. Okay, right. Prabjit, make a list of these things. Okay, Prabjit, then Linta, then Sangeeta, Smita, Swarna, Chitra. Okay, these 6 people you put there. Okay, first we'll correct these letters. Okay, I'm going to send the link now. Okay. Right. Take a picture or whatever it is. Okay, I can take a picture. No. You only take.
You're sharing the link on WhatsApp, right?
Yeah, on the WhatsApp in the group. And if you want to go and recall what I have told, you can see in the YouTube. Okay.
Okay. In YouTube, what should I write?
You just type your name, Abbas Zainli.
Okay, and I'll find it.
Abbas Zainli and Brett Collister, you will get it.
Okay. All right.
Only one YouTube video will be there. Abbas, Zainli and Brett Collister, correct?
Okay, all right.
Or you can write 21011. That is your number. 1011. And Abbas, Zainli, enough. It will come.
All right.
Okay.
Okay.
Okay, fine. Okay,
So
then.
I'll call you after like
yes,
almost
yes.
40 minutes. Yeah.